Happy holidays and welcome to Brunswick Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local health professionals discussing health topics of importance to local residents. Today we will welcome Dr. Yosef Miksh of Brunswick Community Hospital and Deborah Gaskins, lab manager at Brunswick Community Hospital. Dr. Miksh will talk to us about the safety of anesthesia and share some of the new advances in pain control. Then Deb will share information about the lab services at Brunswick Community Hospital. Stay with us for the next half hour as we bring you Brunswick Health Watch. Let's first welcome Dr. Yosef Miksh. First, want to welcome you. Glad to have you here. How long have you been here exactly?
I actually didn't get down here till about July 5th of just this year. Unfortunately, I had to leave my wife and the kids behind for about a month.
Oh, no.
So we got all together finally on August 19th of this year.
Great. So you got here in time for the hot weather.
I did, and you welcomed me with a nice 20-inch rain also.
Oh, yeah, that's right. Forgot about that. Well, it's great to have you here. Are you enjoying the area?
It's been a blessing being here. There's
Really?
a few things. One is closer to my family, or also mine and my wife's family, so it's nice to be able to visit them more frequently with my two little girls. Also, the proximity to the beach, the weather's perfect.
So what were you doing prior to moving to the area?
For the last 15 years, I've been in the Philadelphia area, Philadelphia, Pennsylvania. I've been practicing anesthesiology for the last 5 years up in a major medical center, a major academic institution up in Philadelphia. I also, 2 of those last 5 years, I did work for a small biotech company that specialized in a hemophilia compound. But majority of my focus has been on practicing in patient care and anesthesia.
Patient care. Well, I'd like to hear more about your history. Can you tell us about your education and your background, how you got to be an anesthesiologist?
That I can do. Well, it all started back in Alabama. I was from Birmingham, Alabama. But, you know, I guess as a growing boy, I wanted to get out and experience life, so I ended up in Philadelphia for college. I went to Villanova University, which is just on the outskirts of Philadelphia. Once I graduated there, I went to medical school in Philadelphia, also at a place called Medical College of Pennsylvania, Hahnemann University Hospital.
Very familiar with Hahnemann.
It's a very long name to say, but MCP. After I graduated med school there, I finished there in 2001. I did my residency there. So from 2001 to 2005, I was resident in anesthesiology at MCP Hahnemann. My last year there, I was also the chief resident in anesthesia. I think at that point I just hadn't had enough schooling yet, so I decided when I finished, told my wife I was going to go back for more school, so I decided to go back and get a business degree. So I now have a master's in business. But also at that time I started working at Hahnemann, decided to stay where I trained, and worked for 5 years there while I was at Hahnemann. While I was at Hahnemann, I was the director of the inpatient operating suites, and I was also the director of transplant anesthesia.
My goodness, you've been busy.
It's been a busy life so far, and I'm looking forward to the rest of it.
Well, good. We're certainly glad that you're here with us now. I understand that you're an anesthesiologist with Novant Anesthesia Associates, correct?
That I am.
Can you tell me a little bit more about that group?
The group is composed of 3 physicians, myself obviously, there's a Dr. Williams and Dr. Brand. All 3 of us are board certified by the American Board of Anesthesiology. We also work closely with an outstanding group of CRNAs, or what are called certified registered nurse anesthetists. Combined with them, we build a very nice team approach to providing excellent patient care. As far as their various backgrounds, I know Dr. Williams had worked for JCAHO, which is the overseeing body of healthcare and credentialing of hospitals. And I believe we are a JCAHO certified hospital, so he would be very happy.
We are, absolutely.
And Dr. Brand has worked extensively in private practice for the last 15 to 20 years. And I'm happy to work with these guys and proud to call myself a partner.
Well, great. That's great to hear. So this group, the Novant Anesthesia Associates, you provide all the anesthesia services at Brunswick Community Hospital?
We do. 24/7, 365 days. If you have any anesthesia needs, we'd be happy to fulfill them for you right on Highway 17 in Supply, North Carolina.
Well, great. I'd like to jump in with the most basic question. What exactly is anesthesia?
It's a very difficult question to answer. I mean, I guess as a global view, a lot of people view it as a temporary loss of sensation. I mean, that's the technical definition of anesthesia. Now, when you're starting out and you're a wee little baby and learning your anesthesia, there's 4 terms that they commonly use you for defining anesthesia. One is amnesia, or loss of memory. So you go through your surgery, you don't remember anything. Another term is analgesia, which is you have no pain while you're undergoing whatever procedure you're undergoing. Also coupled with amnesia is unconsciousness. So even though you might not remember, you could still be awake. So we also want you to be asleep. And then lastly is relaxation. So the 4 terms that you commonly learn when going through anesthesia is amnesia, analgesia, unconsciousness, and relaxation. Now, I know that's a mouthful, so basically anesthesia is how myself or another anesthesia care provider will get you through whatever procedure or process that you need to go through.
Let's now welcome Deborah Gaskins. Deb, thank you so much for being here today. It's a pleasure to have you.
Thank you, June. I'm glad I'm here.
I understand that you've been at Brunswick Community Hospital for several years. Is that correct?
Yes, exactly 11 years.
11 years. That is a long time. That is a long time. Well, that's wonderful. Can you tell us a little bit about your background and your education?
I had my training in Florence, South Carolina. I went to a technical school and got married, had children, and then decided to go online and get my BS degree. And I've achieved that, and I have a BS in health administration, and I became the manager of the laboratory.
Wow, that's great. Well, I'm really excited to learn more about the lab. I'm really interested in learning about Brunswick Community Hospital's lab. So how many employees do you have working in the lab?
We have 26 employees, and that's techs, med lab techs, and phlebotomies.
And so that's all levels of different educations? Those are all different?
Phlebotomy is a 6-month technical. You can get it at Brunswick Community College or Southeastern. And MLT you can get at
and what does MLT stand for?
Medical Laboratory Technologist. You can get that at Southeastern or various other places. And if you want to be a MT, then you have to go to a 4-year college.
And MT stands for Medical Technologist?
Correct.
And that's a 4-year program?
Yeah, it's kind of like the RNs and LPNs. RN is a 4-year degree, LPN is a 2-year degree.
Right.
It's the same thing.
Oh, well, that's good. Well, now I've heard that you've added several additional lab tests at the hospital over the past few years. Can you tell me more about those kinds of tests?
Yes. When Novant came to us, we were able to obtain top-notch equipment. And we have the Beckman Coulter for chemistry, so we were able to add several different things. We do the thyroid panel completely, where we used to send them out.
Right.
And also PTHs and cortisols. A lot more. Vitamin B12s, folates that we do. We probably do 85% testing in-house, and the rest we have to send out. But when we get to the new hospital, we're hoping to expand our menu and send less out. So the turnaround time will be better. The patients can get the results quicker.
Yes.
So.
Yeah. So you would say at this time, though, most of the lab tests are offered right at the hospital.
Right at the hospital.
So that saves time and effort on everybody's part. Yeah, that's great news. I understand that there's a pathologist at the hospital also. Let's talk a little bit more about that role.
Pathologist is a doctor that analyzes, looks at, tests your tissue. Whenever you come in and have a procedure, the surgeon, if he has any question about what he's looking at, he'll have the pathologist take a sample, or he'll take a sample and send it to the pathologist. The pathologist looks at it and tells whether it's malignant or benign, or cancerous or not cancerous. And he's there right now. He's there from probably 8:30 and sometimes earlier till noontime or 1 o'clock. Then he has to go to Wilmington Pathology. And we're hoping with the new hospital, we're going to be able to have him all day, all the time.